Generally, when the patient comes to the andrology department, we will give oral as well as verbal instruction to the patient, and we ask the patient how many days he has abstinence, and generally the sexual abstinence should be 2 to 7 days. We instruct the patient to pass urine, wash hands and glands with a good water and wipe it well with a tissue paper, and we instruct the patient not to wash the container because that is a sterile container and he can collect the sample and bring it to the lab, and we strongly instruct the patient not to use oil, soap, cream or any lubricant to collect the sample. And we also ask the patient to collect the first part of the ejaculate, because most of the 70% of the sperms are present in the first ejaculate portion of the sample. So, suppose if the patient missed the first ejaculate part, he has to inform the andrologist. Suppose if the patient are not comfortable to collect the sample in the hospital premises at the collection room, we also advise them to collect from the home and bring it within 1 hour to the andrology lab. So, after collection, you should not keep the sample in a cool place like fridge or near the air cooler, and also you should not expose to sunlight because it increases the temperature, and he has to keep the sample in the shirt pocket or pant pocket or armpit with the body temperature and bring it and deliver to the andrology lab within 1 hour. And this is the instructions we give both in English as well as local regional language like Swahili. So, after the collection, the sample should be delivered in the lab and the sample is incubated for 30 minutes, and the semen, when ejaculated time, it will be watery. After few seconds it becomes thick coagulum, and after 30 to 60 minutes it become again watery and it liquefied. So, this we call it as liquefaction. And also the motility of the sperm decreases after 2 hours. So, we have to analyze the sample within 30 to 60 minutes. So, after 30 minutes we will take the semen sample and check whether it is liquefied or not with the help of a 3 ml transfer pipette, and we see the color, pH, volume and consistency, whether it is viscous or not. So, the normal sample should be homogeneously liquefied and it should not have any clump or anything. So, after noting the volume, viscosity, color and pH of the sample, we will next analyze the sperm motility and morphology. The pH of the semen is measured with the help of a pH of urine, or the patient may have a jaundice. If it is pink or reddish reddish in color, then there may be an infection and there is a chance of mixing RBC in the semen. And next is liquefaction. So, normal semen is liquefied within 15 to 30 minutes, and abnormal it will be more than 60 ml. We call it as hyperviscous sample. So, this hyperviscosity is mainly due to prostatic infection or lack of prostatic protease enzyme. And viscosity, normal viscosity of the semen is smooth and watery, and abnormal is thick with the long threads. This hyperviscous semen samples makes the sperm difficult to move in the semen as well as in the female reproductive tract. And volume, the normal volume should be 1.4 ml and more than that and less than 6 ml, and abnormal if it is less than 1 ml, then it may indicate that there is a dysfunction in the seminal vesicle and prostate gland, and also may be due to a blockage in the ejaculatory duct, or maybe the patient have a retrograde ejaculation, or maybe infection in the male reproductive tract. And if it is more than 6 ml volume, the sperm is diluted, more diluted in the semen, and it is difficult for the sperm to move in the vaginal tract and reach the fertilization site, and also may be due to active infection. The normal pH is between 7.2 to 8, and abnormal if it is less than 7, that is acidic pH and less volume and less density, then there is a chances of congenital bilateral absence of vas deferens, or may be due to ejaculatory duct obstruction, or may be due to secondary sex gland dysfunction. If it is more than 8, that is high alkaline condition, the natural buffering capacity of the semen decreases.